Hello, everyone, and welcome to this audio podcast. This audio podcast is part of the Cortex Narrate series. This audio podcast as part of a Cyclone Cascade, and this audio podcast as part of a Coachella Blitz, and this audio podcast as part of a Storm Robotics production. So, in this audio podcast, a little bit around sort of the sort of an overview in around the ongoing issues in around this. So there are ongoing contentions in relation to the use of CKD terminology as follows. CKD stage 5 can be referred to or termed as end stage renal disease, or ESRD, and sometimes even end stage renal failure, or ESRF. Whilst this means that terminology associated with CKD stages can be interchangeable, it also causes confusion when providing patients with advice and care. uh, and what secondly to this, what defines advanced secondly to this is that is where what defines advanced CKD or ACKD, and should this be CKD stage 4. Many researchers or investigators have focused on ACKD, but there is a need to develop plans to screen patients or recipients who are at risk earlier to minimize further complications. At the same time, CKD stage 3 is subdivided as CKD stages 3A and 3B. But number one, the EGFR reference ranges or laboratory reference ranges are narrow between the two, and so is there a good reason for the division? And second to this point is both subdivisions need to be accompanied by appropriate terminology. If the present classification and identification system continues even if revised. And another point or sort of ongoing sort of issue is there is not always a consensus amongst healthcare professionals, and in the coding relating or regarding terminology. For example, AKI, acute kidney injury, ASRD, end stage renal disease, and ARF, or acute renal failure. This is where there can be misinterpretation and confusion with regard to the CKD stage and classification. And clear definitions and terminology that relate to staging have been outlined, but patients or recipients should know exactly what classification or severity of CKD they have, and the appropriate terminology or definition whereby they are empowered to gain sort of access to knowledge and support in around the healthcare requirements. Scientists and reference laboratories also need to be involved in this sort of discussion and debate. So now in around the concluding aspects of this audio podcast. So in conclusion, this original works look to put CKD guidelines into context in around terms of disease onset and progression to ESRD, end-stage renal disease, AKF, acute kidney failure, ESKD, end-stage kidney disease, CRF, chronic renal failure, and RRT, or renal replacement therapy. As currently there is little or no consensus on how these terminologies, with exception of RRT, albeit RRT in more recent works has now been upgraded to or referred to as KRT, as kidney replacement therapy. However, at the same time, are has been and are being utilized. scientists who have knowledge of clinical parameters, around clinical parameters, and specialist understanding should also be involved in prospective or future discussions, as more health promotion would be required in around this in this critical in this critical area around this critical area. Yes, also just to finally say, as part of this, as part of this audio podcast, um, in context as well, whilst there have been various discussions and perspectives surrounding the issues, for example, in around terminologies, around the terminologies utilized for EGFR, estimated glomerular filtration rate, and GFR, glomerular filtration rate. Uh, um, Glomerular filtration rate, the sort of calculations and equations utilized as well. The healthcare aspects around this are never really have never really been focused or articulated, owing to where the where in around CKD generally, or CKD, or chronic kidney disease generally, there has always been sort of priorities in around and amongst other sort of primary conditions. So at the same time, understanding surrounding healthcare aspects surrounding healthcare aspects pertaining to CKD have rarely put forward into sort of mainstream media, for example, and unfortunately can become misinformed and misinterpreted. That draws this audio podcast to a close. This has been an audio podcast as part of the Cortex Narrate series, an audio podcast as part of a Cyclone Cascade, and this audio podcast as part of a Coachella Blitz, and this audio podcast as part of a Storm Robotics production.